Hello, everyone. I hope you guys are doing well. My name is Wakas Isaac, and I'll be briefly discussing a very important topic in view of step one and step two. We're going to discuss mostly the pathophysiology and the underlying mechanisms going on and relating to our current video. So, the topic is acute coronary syndrome. And in these actual the scenarios that you have in the exams, so my goal is to help you identify the clues that can guide you towards your answer. So first, look at the age of the patient. That's very important, and try to see one of these risk factors. These they are smoking, hypertension, diabetes, hyperlipidemia, obesity, family history of heart disease. Patient can have more than one or more than two risk factors. So that patient will have multiple fold in risk of acute coronary syndrome. So what happens is that so you look for the risk factors, and then you have these symptoms. In acute coronary syndrome, you have a patient that comes to you. For example, he's watching television, sitting on his couch at home, and all of a sudden he starts developing chest pain, nausea, sweating. And chest pain, it will be retrosternal of squeezing quality. And sweating and nausea is it. You can have chest pain in stable angina, but that's related to exertion. But those patients usually do not have sweating and nausea. This is the clues that I usually identify. If you have nausea and sweating along with it, this usually indicating underlying myocardial infarction. So, what's happening on the histological level that's causing the acute coronary syndrome? So, these risk factors, they cause buildup of atherosclerotic plaque, and we have collagen cap that's stabilizing that, and that's keeping that plaque in check from expanding. But all of a sudden, this collagen cap, it breaks off. It exposes the underlying collagen to the blood, and this cholesterol is prothrombotic that causes clot formation, and that clot formation results in acute coronary syndrome. So that's why we know that why it happens all of a sudden. Suddenly that this cap breaks off, and then suddenly the clot forms that leads to occlusion of coronary arteries, and these are different kinds of occlusion that we get. So, and there are types based on the severity of occlusion. So if there is complete occlusion, we have STEMI, ST segment elevation. If a little bit of lumen is left, like 5% lumen is still functioning, that's NSTEMI. And if a little bit greater percentage of lumen is still functioning, that's unstable angina. This is important to keep in mind, because the degree of occlusion is going to explain why these are different. So in STEMI, we have complete occlusion that's causing transmural infarction. Transmural means that the whole thickness of ventricle is going to be infarcted. So this is the wall of ventricle, and there's the area of infarction that's killing all these myocytes, all of these cardiac myocytes. So, but in NSTEMI, we have subendocardial infarction that's killing inner third of the ventricular layer. So that shows that the STEMI is more severe, while NSTEMI is less severe. So the area degree of infarction is very important to keep in mind. So this is gonna cause, obviously infarction is happening, is gonna cause cell death, and when cardiac cells die, cardiac enzymes they come out in the blood, so we have elevated cardiac enzymes. And same thing happens with the NSTEMI. The degree of elevation is a little bit less with NSTEMI, while it is greater with STEMI, because a greater amount of cells are dying in this case, as evidenced by these two diagrams. We can see the difference. So, and ECG changes, obviously, in ST segment elevation, we have ST elevation going on, while in STEMI, we have ST depression and T wave inversions. And obviously, which area of heart is being damaged is represented by different leads in ECG. For example, if we have ST elevation in lead 2, 3, and AVF, that's showing inferior wall MI. That's an inferior wall is mostly formed by right ventricle. That is an entirely different topic. We will discuss that in our future videos. So basically, we can identify which area is being damaged based on ST elevation in different leads. And the same thing goes with the NSTEMI. We can identify those areas, but the difference is that you will have ST segment depression and T wave inversions. So we have the STEMI and NSTEMI. These two have ECG changes and they have elevated cardiac enzymes. While in unstable angina, we have ECG changes, but cardiac enzymes will be normal. This is the thing that differentiates it from these two. The overall presentation will be the same. Patient will be at rest, and all of a sudden he has chest pain and everything, but there will be no elevation of cardiac enzymes because the degree of occlusion is not severe enough to cause infarction. Infarction is not happening. Ischemia is happening because there is compromised oxygen supply to the cardiac myocytes. And when they have low oxygen supply, that leads to voltage changes, and that causes ST. And ECG changes can be ST depression or T wave inversion, but cardiac enzymes, they are normal. So these are different kinds of acute coronary syndrome based on the degree of severity of occlusion. And occlusion happens all of a sudden when the collagen cap ruptured and the underlying atherosclerotic plaque, the cholesterol, become exposed to blood, which was prothrombotic, that led to clot that caused sudden onset of these symptoms. And why we had this atherosclerotic clot is because of these risk factors that we have: smoking, hypertension, diabetes, hyperlipidemia, obesity, family history of heart disease. So while doing question, now you have all these basic knowledge. So first you will keep the age of patient first. That's important. Usually it will be an older male, mostly males, more than greater than 50-year-old who has either of these risk factors and he has sudden onset of these symptoms. And then when you do the ECG, you have either of these ECG findings, whether ST segment depression or elevation, and you have elevated cardiac enzymes in these two, while cardiac enzymes will be normal in this. So this is pretty much about this video. This is related to step 1. We will talk about the management and the complications in a separate video. So take care, guys. Hope to see you in the next video.